Sorry, not sorry. We're talking about how to advocate for your own mental health at work. I'm also going to try to integrate a bit about if you are a leader. I imagine there's a lot of managers, maybe executives, CEOs in the audience. So also ways that you can set the tone for the culture in your workspace, because it's really important to do that when you're in positions of power. And also, if mental health is not really part of the conversation at your office, how can each of us individually kind of be that champion, that wellness advocate in our workspace? So, about me, I know Jamin said that I'm a clinical psychologist. I don't actually treat people in my current role. I'm not a clinician, although I was a clinician for 10 years. I'm a mental health strategist, and I work on a lot of help with policy, procedures, communications, do a lot of consulting about programming, making shifts in the workplace, shifting business practices, and critical incident response support. So it's an interesting role. I've been doing that for just the last year or so, and before that worked in university health for about a decade with young adults. So there's a lot of clinical, and there's also a lot of industrial organizational psych kind of stuff woven into this. So this is kind of where we're going today, talking about, of course, why it's important. I think we all know, it's kind of obvious, right? We're at this AnxietyTech conference, but good to review a bit, navigating the benefit system. And then the feedback I got is that people want to hear mostly about the talk. How do I actually have the talk, the mental health talk at work? How do I bring it up and what to do? So that's where most of the time is going to be spent today. So why is this important? So about 20% of adults in the United States live with a mental health condition at any time. But the operative word here is live. People hear this statistic a lot and go, oh, wow, 20% of people are crippled by anxiety, or 18% have anxiety conditions. That's true, but I think it's really important, as some of the speakers have related to already, that it's incredibly common for people with mental health diagnoses to thrive. And I actually want to talk a bit about resilience and how that can be built in. A lot of talk about resilience is about preventing the mental health condition to present in the first place. But I think I want to shift that kind of nomenclature and that talk more to, it's not about presenting these issues to arise in the first place, because a lot of us are predisposed, or we can't help things that happen to us in our life, right? That help, that kind of push mental health conditions to present. It's rather how we react and what we do next. And so often I meet people with mental health diagnoses that are thriving, and there's so many people you would never know have mental health conditions, and I look at them and they're really inspiring. I mean, look at all the people that have already talked today and shared what they shared. And if we can start to be more vocal about that, focusing, of course, on the impact it has on us, but even more so on what we've done to take care of ourselves, and just highlighting how actual hard it is to get the right kind of treatment and to get back on the right track, we can start to destigmatize the talk around this and improve the culture and the conversation around mental health, especially in the workplace. So, also important, treatment is effective 80% of the time. And I would also beg to argue that for the other 20% of folks, maybe they haven't found the right treatment set for them yet. And I also want to acknowledge as a provider in the system that the system is not where it needs to be yet to support people to navigate the process. For those of you that have engaged in treatment, especially multiple types of treatment, maybe medication and therapy and alternative things, it's not easy. It's not easy to navigate the benefit system. It's not easy to navigate the insurance system. It's not easy to get things paid for. It's not easy to know the differences between the 5 or 7 mental health providers that are out there, and which one should you go to, and how do you pick the right specialty. So I just want to acknowledge there's a long way to go, but it is possible. I think we're headed in the right direction, but the profession as a whole does have some time. I think employers, especially employers with a lot of power and a lot of resources, can be trailblazers in this, and that's pretty exciting. Direct impacts to mental health. I have some listed here, but I'm going to highlight physical health. It's not uncommon that the conversation, especially when you talk to HR teams and benefit teams, they really differentiate between mental health and other wellness stuff and medical. I like to think of mental health, when we talk about medical providers, everybody has their own specialty, while mental health really is a medical specialty in and of its own right. And if we're not paying attention to how mental health affects the whole physical system. For example, we're talking about AnxietyTech today, so anxiety, it can affect chronic pain, migraines, respiratory health, the way your body actually processes sugar, sleep, certainly sleep, which affects everything else in the system, physical and mental health and otherwise. So I think it's time to stop talking about these as two different entities. It's even time to stop talking about them as two different entities that are integrated or that interact and affect one another. But they really are one as part of the same system, and we have to pay attention to both. And this is why, a lot of employers, they put so much focus on medical and giving people really good medical plans. Let's make sure that mental health is a part of that as well. So navigating the benefit system. So I'm going to spend less time on this, so it might be a little quick, but I can share slides. There's my contact information at the end. And you can also find me online on LinkedIn, and I can share my slides with you. I'm happy to do that so you can go through later, and I'm going to focus more on the talk at the end. But first and foremost, partnering with HR. Now, I understand HR is not there to be your counselor. That wouldn't be right. But they are there to help you navigate the existing system at work. They're actually usually really eager to help as well, and they're to help you think through your options and to make sure that you're making an informed decision and utilizing what exists already. I think a lot of people are surprised when they talk to HR. They're like, I didn't even know we had a gym discount or a health benefit that allows for like childcare resources. My spouse's employer actually gives a childcare discount, 15% off, which in the Bay Area for 2 kids, I'm the mother of 2, that's a lot of money. That's amazing. They also provide emergency backup childcare. Okay, so that doesn't necessarily feel like it's mental health related, but it is, because it allows us to take time for ourselves when we need it, to make sure that we can go to therapy appointments, so that we can work long hours and not worry about our kids if we need to, so that we're getting enough sleep at night. There's a lot in place there, just as like one example. There's a lot of other things listed here that a lot of employers are offering today. I put wellness apps up here. This is a new space that employers are getting into. I know there's a lot of people talking about apps today. Pay attention. If you're an employer, consider offering that as part of your benefit package, because it can certainly complement the rest of the health suite that you are offering. Something else I'll add here is something I do as a consultant is not to necessarily help employers recommend like additional programs that they can put in their benefits package, but to look at why is a benefit underutilized, or why is a benefit that is well utilized not effective, because sometimes it's just a benefit redesign. So we can look at the product and look at what is getting in the way of people using what's already there, and then let's solve for that instead of like throwing more benefits at employees if they aren't even using what already exists. Another piece, peer support and mentoring. Salome earlier was talking about, she had a slide on the peer support kind of apps and things that exist. I think paying attention to that is really important, especially for people who are moving there for like a new job, employees like fresh out of college, new city, or maybe you're transferring and bringing your whole family with you or coming from another country. Connecting with peer support is one of the top clinical recommendations made to people kind of coming into a new space, a new workspace, or a new environment. Ideally, there's something internal. If not, you can consider starting something for your employer. But if you can't find it there, then try to find it outside of work, professional organizations, so through social media. But it's very important, and this serves as a huge buffer for the risk of mental health issues kind of being exacerbated or presenting in the first place, and can help to build resiliency as well. Now, accommodations. So I'm not going to go into this a lot, but there's a link here at the bottom, the Job Accommodation Network. The issue with accommodations, honestly, is that a lot of providers don't know how to write them. They write accommodations because you have to get it written off usually by like a mental health provider to sign off for it. They write them that are too vague or not specific enough. This person needs something to help them kind of manage distraction. HR doesn't know what to do with that. So partner with your provider in finding something very specific that works for you. And if you need ideas, you can visit this website. Go on there with your provider, for example, to find something that fits. They even make recommendations by diagnosis or presenting issue. So for example, people with anxiety issues, we hear a lot like, I just need noise canceling headphones, or I need to not be in a high traffic foot traffic area on my desk, or I need to be turned towards a wall. These are very easy accommodations that most employers will say yes to, but they're not going to be able to recommend them. That recommendation has to come from your provider, but you can collaborate and make those recommendations to your provider and see if they agree and if it's clinically indicated. Leave of absence is a higher level. I think there's a lot of misunderstanding about the leave of absence process. I will acknowledge, ideally there could be, like, my fantasy is a system overhaul in helping people navigate the process, because when somebody's at the level where they need a leave, to navigate the leave itself exacerbates symptoms, and it's very terrible. I'm just honest about that. It's not great. But a lot of times people get the leave. You also need somebody to sign off, so talk to HR, talk to your providers to make sure, but don't file paperwork until you maybe have a provider is my recommendation, just because once you file paperwork with your employer to take a leave, the clock starts to get it signed off on by your provider. So you want to make sure that they're going to sign off, or else you're kind of possibly making it a little harder for you. But what happens is people take the leave, and then as soon as they're on leave, they go, oh, my symptoms are reducing. I don't have these stressors. This is great. And then they don't actually engage in the treatment that they need while on leave. And then they come back, and they're like, I'm feeling much better. What happens? Work comes back on. Responsibility, stress comes back on. The symptoms exacerbate. It's doing a disservice both to the employer and to the employee when people don't engage in intensive treatment while on leave. Employers, at the same time, don't think that a leave of absence for medical or mental health reasons is a break. It's not a break. Ideally, these individuals are really focusing on taking care of themselves and are working hard to get back to their former level of functioning. I think my favorite is when people are like, oh, you're going on maternity leave for the second time, second kid. That's great. It's going to be so nice to take a break from work. I'm sorry, what? I'm sure there's a lot of parents in the audience, right? It is not a break. So I just want to kind of clear that up, that kind of culture shift should take place at work, especially for new parents and people with other responsibilities like that. So now we're going to shift into the talk a bit. So the double bind. And what I mean by this is, okay, so this is what I hear from people coming in saying they're afraid to have the talk at work. And kind of as a side, we've all had the talk in other ways, right? We have the talk about sex. We have the talk about drugs. When do we have the talk about mental health? A lot of people don't have it until they actually end up in therapy with a therapist. It doesn't happen in their families. I mean, not everybody. Some families are good about talking about it, but it doesn't happen at work. It doesn't happen in college. So I get to be the therapist, the lucky therapist. Sometimes the person's in front of me, and that's the first time they've ever even considered that it's an issue. And usually, if it's by then, it's usually at a bad spot if it's not part of their vocabulary. So if they do talk about mental health, the fear is there's going to be retaliation, people are going to judge me for it, or I don't want to be a burden on my employer. But what's the flip side? I don't talk about it at work, and then what? People don't know I'm struggling with this. They don't know how to support me. People don't understand maybe when my work is less than perfect or when I'm having an off day. I want to clarify that I'm not here today to say you have to talk about your mental health at work or you don't have to talk about your mental health at work. But I want to empower you to make an informed decision so that you feel confident in your decision moving forward and that you have a good sense of when to talk about it, timing. We're going to talk about timing, what to look for, what to share, not to share, and how to do it. Okay, so the power of modeling. How many of you took Latin in college? I feel like people, okay, a handful. A lot of people aren't taking Latin in college anymore. Noblesse oblige. Does anybody know what that means? Yeah. Noble obligation. Yeah, the duty of the nobility. So with great privilege comes great responsibility. So I put this slide in here because I'm actually talking to people in leadership positions. And a lot of people sometimes are like, I'm a manager, I'm not a leader. You're a leader. Somebody's looking up to you if you're not just starting out. It's really up to leadership to set the tone at the organization about shifting the culture to allow for permission to talk about mental health. Now, how can you do that? You can be explicit and start to have those conversations. I encourage leaders to share what they're doing to take care of themselves. I encourage leaders to check in with folks, not like, hey, let's talk about your mental health. Maybe inappropriate, but what can I do as a leader or a manager to make sure you're getting your needs met? What can I do to support you better? Anything that you need, That's a really easy way, and then it kind of gives the employee nonverbal permission that if I'm going to bring something up, now's probably the time to do it, or this person might be safe to if it's needed later down the road. And also the greater conversation at the kind of higher leadership executive level, VPs and things, when you're creating policies, are you taking mental health and what the impacts of that policy change might be into the decision-making process? That's another thing I do consult on, kind of at that high level. And if it's not happening, something to consider, do you have the power to make that shift within your company? So before you have the conversation or the talk with your boss or HR, consider, is there psychological safety? Psychological safety, I have the quote up there of what it is. Do you all know Brené Brown's work on vulnerability? I see a lot of heads nodding. To me, psychological safety is really about people having permission to take risks. Psychological safety is permission to be vulnerable, because when I'm vulnerable, I'm assuming that I'm going to be met when there's psychological safety on the side of empathy and connection and understanding. And that feels really good and really empowering. I know I'm not going to be shamed for taking that risk and talking about this. When psychological safety doesn't exist, I'm either taking the risk and kind of going for it, but I'm also risking being embarrassed and being shamed or being judged. That doesn't feel good. Or most often what she talks about is it leads people to inaction. They're stuck. So then I'm still not getting my needs met. And what happens is it tends to build, because that means it's still on your mind. You want to talk about it, you want to share it, but you can't. So what happens if psychological safety doesn't exist in the workplace? It doesn't mean not to talk about it, just know it's more of a risk if you choose to do so. And it may be more on you to get your mental health needs met outside of the workplace. It's a greater burden on you outside of work. Not ideal, but you can decide, is that employer right for you? More people nowadays are looking for employers that actually foster this on working teams, and that's really important. So if you have a really high attrition in your group or really high attrition in your workspace, I would challenge you to look at other factors that contribute to burnout and attrition, but also look at what psychological safety exists. How do you tell if it does exist? How are other people treated when they take risks in the workplace and things that are not related to mental health? How are people treated when they do health-related activities? Are they given time to do this? Somebody takes a 2-hour lunch because they have to go to a doctor's appointment. What's the reaction? Is the rest of the team resentful? Is there enough backfill for people to take time to take care of themselves? It becomes very much a systemic issue. But that's something for you to consider. And then this can help you make a decision. Do I even want to have the conversation in the first place? Next is timing. Ideally, it's private. One-on-one versus in a team is a good place to start. On rush, if you bring it up in the last 5 minutes of a 30-minute meeting with your boss, maybe not the ideal time. They're not going to have time to respond. Performance revals is on here. It's not uncommon that mental health issues come up for the first time when somebody gets a bad mark on a performance evaluation. It's not bad that it comes up during then, but the issue is your manager now can't do anything to help you prevent it from showing up on your performance. So if you identify that you're having a mental health issue before, you can have that conversation with your boss, you can collaborate and come up with a solution so that it doesn't affect your performance and you can get the support you need. Because at this point, if it's showing up, there's probably not a lot that your boss can do to get it off of your performance evaluation. No substances. I know that seems silly to put on there. Like, why would I have a conversation with my boss drunk? You'd be surprised at how many people with anxiety actually use substances to manage their anxiety about having the conversation so they can have the conversation. But what happens is then they may not be thinking clearly about how much they want to share or what they want to share when. Also, a lot of, especially tech companies, have alcohol flowing freely at social events. So then you finally get the gumption and your inhibitions lower. You're like, I'm going to tell you 3 drinks deep, 4 drinks deep. It may not be well received. Or they may not, maybe you're okay, you've only had 1 or 2, but your employer has had 4 or 5. They're not going to hear it, right? So it's just something to consider, and not during a crisis. It's also very common for it to come up during a crisis. Again, not a bad thing, but not ideal, because then it's harder to set a plan in place for you to get the backfill so you don't have to focus so much on work so you can focus on yourself. So again, it's okay if it comes up in these, but ideally you kind of talk about it earlier so you have a plan in place. Now, what to share? Instead of focusing on diagnosis, I think it's not to say not to share diagnosis, but it's more important to focus on the impact that it has on you. Here's why. Let's say you have post-traumatic stress disorder, which is an anxiety disorder, and you share with your boss, I have PTSD and I really need support for my PTSD. Your boss, they're human nature, they're going to relate it to who else do they know? What do they know about trauma? Well, my Uncle Jerry is a Vietnam vet and he has PTSD, and this is how I know to support my Uncle Jerry, so that's how I'm going to support you. Do you think your PTSD is like Jerry's PTSD? Even if you're also a Vietnam vet? Probably not. And the support that you need is also probably going to be tailored and individualized. These mental health conditions are so hyper-individualized from person to person. The support and the care needed also is. So instead of focusing on the diagnosis, if you focus on the impact, your boss is going to better be able to understand it. For example, I really struggle with anxiety issues, and so it actually causes me to have a lot of insomnia at night because of racing thoughts. I have problems sleeping. And so first thing in the morning, I'm really groggy, and it's hard for me to focus. So you might see me coming in late occasionally, but I promise, I really dedicate to you that if you're okay with me coming in late occasionally, I will stay late those days. I will get my work done. Or can we please not schedule meetings one-on-ones first thing in the morning? My brain's really not on at that time. When we schedule them in the afternoon, I'm much better, I'm much fresher. Most employers can go like, oh yeah, totally. They can get on board with that. And also talk about what you're doing to get yourself help. I do a lot of management consultations, and managers like, I'm really worried about my employee. They told me they have PTSD or depression, and I just want to make sure they're getting help. I don't know if they're in counseling. And they also get scared to ask because they don't want to intrude. They don't know what the boundaries are. It's okay for as an employer, as a manager, to say, well, what are you doing to take care of yourself? Because that helps quell the manager's anxiety a little bit. It's not their responsibility, to take care of the mental health, just to support it. But if you share that with your manager, you want to be proactive. Don't worry, I'm working with my doctors. I got it covered. They feel more confident in your ability to make sure you are well and healthy, and then more confident in your ability to engage in work. And then asking for support, like the thing, like, please let's not schedule one-on-ones in the morning. That's easy. It's reasonable, it's specific, it's concrete. But when people say things like, I just need more support, I just need to be able to leave whenever I want, I just need, some of these are more like vague. It's not saying that that's not the right support, but a manager is going to have a harder time wrapping their head around it and knowing that they're supporting you in the right way. So as a manager, you can also collaborate and kind of drill down at like, specifically, what can I do? What do you need from me? Well, I don't know. Okay, well, let me connect you with the benefits team or the HR team and make sure you're getting the right support. If you don't know what you want, that's also okay. Or if you don't know what you need, that's also okay. Perfect for you then to work with your counselor to figure that out. I would say that's like kind of, if mental health is impacting your work, that should be one of the first stages of treatment, is figuring out what you need in the workplace to succeed. Other tips and tricks, I know we're about out of time, so I'm going to focus on active recovery. And I know this is talked about a little bit today, but a lot of people need to detach when they come home. And it's not about completely disengaging and dissociating from work, but it's about what are you doing in your downtime to get better. Screen time is used. I'll just use that as an example. Screen time is used a lot as downtime to help people disengage from work. Video games, cell phones, social media, TV. I'm not saying that's bad, but it depends on the intent and how it's used. That can be maladaptive, can be unhealthy. And what I mean by that, are you coming home and you feel compelled or it's compulsory to play this video game because your brain is spinning so much and you can't disconnect from work, and that's the only thing you can do to get your brain off of it, but as soon as you turn that video game off, your brain is spinning again, the anxiety kicks up, you're not enjoying it, it doesn't feel good, you can't set a time limit around it, but you're able to set, it's intentional, you come home, here's the difference, where it can be healthy and helpful. If you're choosing that as a means of disconnection, you understand why, it's time limited, and it's enjoyable, then it can actually be a self-care activity. I also like to encourage exercise. It's a really something physical. It doesn't have to be vigorous exercise. It can be walking your dog. It can be just getting outside and taking a swim, or whatever works for you, taking a bike ride. But physical exertion really does help to decrease levels of the neurotransmitters that are released in your system when you're super anxious. And that's one of the things I think that's really easy to partner with mental health. And there's other tips and tricks on here. I will share the slides. The one thing I'll say, share your work style and your byline. It's really easy to say, if you see me answering emails, late at night, it's because I enjoy a flexible work style so that I can have more time with my kids. That's an easy way also to tell people how you work, and there's a nonverbal communication in that I'm not asking you to respond to my email at 10 o'clock at night. I'm also not overextending myself. I'm being intentional about working at 10 o'clock at night or 2 in the morning. And that's also a way to easily set the tone of mental health and wellness in the workplace. So thank you. If you have questions, you can find me. There's my Twitter, and then there's my personal email. I'm also on LinkedIn. So feel free to send me questions, or if you have questions about also your workspace, I'm happy to provide brief consultations and kind of point you in the right direction, or about the presentation itself. Enjoy the rest of the conference. Thanks.